Good evening. We're live once again with another episode of Diabetes Darbar. Uh, let's wait for a few minutes. Let people join. And if you can hear me clearly, please type yes. Please confirm if you can hear me. Please type yes. I'll wait for a couple of minutes for everybody to join. Okay, before I start the session, I would like to tell you that today is Wednesday and I come live on. Before I start the session, I would like to tell you that today is Wednesday and I come. Navnita, you can reduce the voice, huh?
Hmm.
Huh. So today is Wednesday. I come live on every first and second Wednesday at 9 p.m. On Diaphit app. You can download Diaphit app if you haven't downloaded yet. Uh, and just remember that Diaphit app is only available on Android phone, not on iOS. So I'll be coming live at 9 p.m. once again, and there you can interact with me live. Uh, the only difference is I can hear you, but I cannot see you, but you can see me, and it's not free. There's a very minimal charge, so only interested people, only serious people needs to download the app and connect with me on Diaphit app. Okay. If you can hear me, just confirm that you can hear me properly. Okay. Second thing is, yesterday there were a lot of people passing negative comments. As a result, we were forced to stop those people coming and commenting and trolling us. That's why we have decided that only those people can comment who are member of this channel. So if you are not yet a member, please be a member of this channel, and then only you'll be able to ask a question. Okay. Hi, how are you? Good, I'm doing good. Sir, you are the only doctor who teaches us about diabetic A to Z. It is the main reason for me to teach you is because I was diabetic once 8 years back. 2017, I was diagnosed with diabetes, and I think Navnita, would you like to share some interesting story between you and me on 2017 when I was diagnosed with diabetes?
Good evening, all. I know Dr. Anupam was also struggling from diabetes during the year of 2017. So he was also under medication and he was following many of the diet chart provided by other nutritionists. So he has done his own research, and after doing his own research, he have recovered successfully. And very soon he started making videos.
No,
Uh,
between you and me, remember 2017. You want to share that?
Yes, yes, yes. So, doctor told me that he will definitely study his own research, and he has followed his own diet chart. He has created his own research, and he has recovered well from diabetes. Then he told me that I would like to start up my own. Definitely, he has started start up with the Diaphit. It has been since
No, no, no.
2007.
I'm talking about when I contacted you. Want to share that?
Yes,
In
doctor contacted
2007.
me to join him, but I had my own works to do.
No, no, no. 2017 when I was diagnosed with diabetes. You remember?
Yes, yes, yes. That's what I'm saying. When you were diagnosed with diabetes, that time you told me that
Mhm.
you are following the diet provided by other nutritionists as well, and
Mm.
you have done your own studies, and you told me you have reversed your diabetes. That's what I remember.
The diet I asked you to guide me.
Yes, yes, yes. I have also provided him a diet chart. Okay.
Yeah. So now actually what I want to tell you is, uh, whenever somebody gets diagnosed with diabetes, what they don't go to doctors these days. They don't go to dietitian. They go to YouTube. I had been doing the same thing. I had done the same thing, and I followed 6 months different kind of diet. I drank a lot of juices. I did walking. I did yoga. I had fruits and I had millets. But unfortunately, nothing was working. And then I decided to do my own research. I did my own research and I reversed my diabetes. Okay. So when I reversed my diabetes, that time I did a lot of hard work. I did a lot of research to reverse my own diabetes, and this is how I know a lot about diabetes, how to reverse, and this is how I'm teaching people now. And that's why we are getting this comment, sorry, you are the only doctor who teaches us about diabetic A to Z, because reversal of diabetes is not mentioned in any of the nutritional book. It is not mentioned in any of the medical books. So research work has to be done, and I did the research work for reversing my own diabetes. And I started YouTube channel because I was also diabetic, and I came to YouTube channel to find a solution which I could not. And when I reversed my diabetes, I realized that I should be starting my own channel so that I can guide people, because most of the people these days they want um, a solution from YouTube or Google. And now another mode has come these days, that is called Chat GPT. People don't go to doctors because they have lost all their faith in doctors, because doctors only prescribe medicine, and they want to be out of medicine. But unfortunately, our medical system uh, has become a medical industry. Medical system has become medical industry. We were not taught about nutrition, and that's why we cannot guide about proper uh, food intake. As a result, none of them were able to reverse their diabetes. I was lucky enough that I was in the research side for almost 16 years before I reversed my diabetes. And I am still researching, I am still studying, I am still a learner, I am still a student, and I will always be a student. This is what I plan to and will be. As a result, a teacher has to be a student first, then only he can teach you properly, because unless and until you learn, you will not be able to teach. Okay, we have one question. Hello sir, I am 39-year-old male. I am diabetic from past 10 years. Okay, so he's 39 years old male, past diabetic from past 10 years, means he was diagnosed at the age of 29. My fasting insulin is 2.19, C peptide is 1.06. My HB1C is not coming down from 8.4 to 9. Okay. My endocrinologist suggested me Ozempic. So Ozempic has uh, is in the trend these days. It's an easy way to bring down your weight. It's an easy way to bring down your sugar, but everything is temporary. Weekly injection metformin 1 gram plus sitagliptin and glycoside 60. My HbA1c is reduced to 6.5. Now, should I continue this prescription? So, I would recommend you to consult your endocrinologist, since he has given you the Ozempic. So, I'll recommend you please consult your endocrinologist. If you want my recommendation, then you can consult me. Below is the number. You can book an appointment with me, and then I'll guide you what to do. Okay, here I cannot give you the consultation, because since you had taken consultation from an endocrinologist, So it's better you take his suggestion whether what to do now. Okay. And I can assure you that the moment you stop Ozempic and all the drugs, your sugar level will go high. Your HB1s will be increased. Okay. So consult your endocrinologist. If you want my consultation, definitely you can book my consultation. I'll see all your reports and then I'll guide you whether you need medicine or not. Um, I don't recommend any medicine, unlike endocrinologist. I prefer and recommend lifestyle modification. In lifestyle modification, there are various factors like nutrition, then exercise, reducing your stress, having proper sleep. So these are the factors which I recommend. So it's your choice now whether you want to continue with your endocrinologist or you want to have a consultation with me. You are most welcome, and then I'll discuss with you. Sir, I always strength training 30 minutes, 6 day week. Is it okay? Yes, perfectly fine. Strength training, absolutely the best way to control your blood sugar, to lose weight. Those are the things. Or should try for reversing my diabetes and avoid. Definitely, I don't recommend injections like Ozempic. I know it is called semaglutide. I know that, and I don't recommend any kind of drugs. I always recommend this channel is for reversing diabetes. Endocrinologists, they will give you a easy solution. I give a very tough solution. My path is not easy, but the journey is really good. And once you reach your destination, you will enjoy beyond that. Okay. So whatever I teach, it's not easy. It's difficult to follow initially, but once you get into the system, you will be in a great position. I am in this system for almost 8 years now. I eat everything. Today I felt like eating paratha. I ate paratha. My blood sugar is absolutely normal. My weight is under control. So I teach people how to reverse diabetes, how to lose weight without medicine, and how you can eat paratha or biscuit or namkeen or whatever you like whenever you feel like, how to eat that. Okay, because we teach quantified nutrition. What is quantified nutrition? Quantified nutrition is whatever you eat, you need to quantify, you need to measure it, you need to understand what portion of food or which food has what amount of protein, carbohydrate, fat. And this is the concept of DIAAFIT diet. So what exactly is DIAAFIT diet? It is nothing but you calculate your total daily energy expenditure, and out of those total daily energy expenditure is nothing but calories, the amount of calories which you need to eat on a daily basis to maintain your weight. If you want to lose weight, you need to be in a calorie deficit diet. If you want to gain weight, then you need to be in a calorie surplus diet. You calculate 26% of your calories should be coming from carbohydrate, 1.5 to 2.5 gram per kg body weight should be coming from protein, and the remaining calories should be coming from healthy fat. So if you understand this, then you will be able to reverse your diabetes. So, okay, sir, I think I still have hope of reversal. Yes, definitely. If your body is producing insulin, if your endocrinologist has given you Ozempic, so I am assuming that you must be overweight, because Ozempic is given for to obese patient who are obese or overweight to reduce weight. So I am assuming you didn't mention what is your BMI, but I'm assuming that you are overweight or obese, and that's why your endocrinologist must have given you Ozempic. So if you're obese, which means you are insulin resistant, and if you're insulin resistant, then definitely you can reverse your diabetes. So please advise about good quality blood check machine. No machine is good, no machine is bad. Nothing will give you accurate reading. It is all estimate. Every glucometer will have plus minus 20%. Plus minus 20%. It can be 20% more, it can be 20% less. So nothing is accurate. Okay, so you can take any whatever glucometer you feel like. Okay. Navnita, do you have any question for me?
Yes, doctor. There's a question. How can I reverse or stop metabolic syndrome if I already have type 2 diabetes?
Sorry, can you come again?
How can I reverse or stop metabolic syndrome if I already have type 2 diabetes?
See, how can I stop metabolic syndrome? Okay, let's understand what metabolic syndrome is. Let's understand the concept. Metabolic syndrome. When I say syndrome, it means it is a combination of various disorders, and usually metabolic syndrome means when you have diabetes. It could be diabetes, it could be obesity, it could be dyslipidemia, it could be hypertension. Usually, these are the four diseases or whatever symptoms or whatever you want to say. These four together constitute metabolic syndrome. So if you have metabolic syndrome, you will be having diabetes. Okay. Now, why do you have diabetes or why are you obese? Okay. So you are obese or you are diabetic because of insulin resistance. So you need to manage or reverse insulin resistance. Why are you dyslipidemic? You are dyslipidemic because you eat excess carbohydrate. Why do you have hypertension? Because you have a sedentary lifestyle. So you need to follow a holistic approach. You need to follow a holistic approach. The most important thing is follow diet. In diet, what you have to do is you have to reduce your carbohydrate intake. The carbohydrate intake has to be below 26% of your total calories which you are taking on a daily basis. There has to be optimum amount of protein, and that is 1.5 to 2 gram 2.5 gram per kg body weight of protein. That much protein you need on a daily basis if you want to reverse metabolic syndrome like diabetes, obesity, dyslipidemia, hypertension. Okay, so I hope this is clear. Did I answer the question, Navnita, or anything else? Should I explain?
Okay, doctor.
That's fine. Nah? So if you want to reverse diabetes, follow Diaphit diet, do strength training. Okay, so just 1 second. Just 1 second. So Piyush is saying I am 84, 5 feet 7. So you come under overweight category, and that's why your doctor has given Ozempic. You are overweight means your body is producing enough insulin. Okay. How to reverse diabetes? Watch all my videos. If you can't do it yourself, please join our coaching program. And I'm really very surprised somebody who can take Ozempic, which is very expensive, and not joining my coaching program. This is very surprising. It's very surprising. Do you know, Navnita, what is the cost of Ozempic? It's very expensive. It's very expensive, even though it's a weekly injection, but it is very expensive. And I'm sure our coaching program cost much less than Ozempic. Okay, so if you can afford Ozempic, you can afford our coaching program. If you can join our coaching program, and we will teach you, will guide you how to reverse your diabetes without taking any medicine. Thousands and lakhs of people are doing it, following us, and you too can do it. Okay. Sir, can we use extra virgin olive oil on cooked rotis? Provided you are not using extra virgin olive oil for cooking purposes. Okay, for cooking purpose, you can apply it on top. But the moment you heat extra virgin olive oil, then it gets oxidized and it becomes poison. Okay, so why? Because its heating point is very very low. So we take something, uh, or smoking point, whatever you want to call, smoking point, heating point, whatever you want to say, smoking point, usually we use that terminology. If the smoking point for a oil is high, like ghee or coconut oil or mustard oil, those oil are good for cooking. Olive oil is not good for cooking, but I've seen many people make this mistake that they use extra virgin olive oil to cook food. The moment you heat, okay, तड़का लगाते हैं ना वो, the moment you use those Indian style cooking, then it becomes poison. Okay, and it causes inflammation in the body. So avoid that. Okay, so if you're still not a member of this channel, many people might thinking, why am I not able to comment? It's because now we have become more strict. I don't want any people coming here and trolling us and asking all stupid questions. I want only serious people to ask questions who want to reverse their diabetes, who are serious about their diabetes. So you need to be a member of this channel. It's you can click on the join button. It's less than the membership is less than one pizza, half of a pizza. Okay, so if you're serious about your health, be a member of this channel. You can ask a question, and I'll be taking most of the question live. Any other question, Navnita?
What is the treatment goal for diabetes?
Treatment goal. Can you just elaborate a little bit? I'm not able to understand.
Means what is the treatment goal for diabetes? Means what all treatment can be done?
Okay. So if you talk of treatment, being a medical doctor, uh, I'll say it is there is the first way is pharmacological treatment. Okay, when I say pharmacological treatment means you are diabetic and then we will prescribe medicine. There are different categories of medicine, uh, like uh, like biguanides, like sulfonylureas, and many more new categories have come. So I'm not interested in that pathway. If you are interested in medicine, pharmacological way, you can follow any doctor. You can visit any doctor. You can visit any endocrinologist. I teach the other way, and that is the lifestyle modification. That is a different way where we teach people how to reverse their diabetes, how to control their diabetes without medicine. Okay, so these are the two ways by which you can control or reverse your diabetes. One is pharmacological way, and the other is non-pharmacological way. So we in Diaphit we teach people how to reverse their diabetes without medicine. So if you want to reverse your diabetes, whether you can reverse your diabetes, then you need to have a proper consultation with me. Then I'll see all your reports. The most important report is fasting insulin and C peptide, and then I can guide you whether you will be able to reverse your diabetes or not. And thereafter you can watch all my videos. If you can't reverse your diabetes without watching my videos, then you're most welcome to join our coaching program. Below mentioned are the numbers, or on top if you're watching in a vertical mode, then here are the number. You can, or below, you can click the number and call us. We'll be happy to guide you in your reversal journey. Okay. Any more question?
What is the link between obesity and diabetes?
Very good question. That's very, very good question. Whoever has asked, I think, uh, very interesting question as well. So let's understand, and both are related to one thing only. Both are related to one factor that is called insulin resistance. It's very simple. So let's keep insulin resistance here and obesity here and diabetes here. Insulin resistance is in between. So if you're obese, means you are insulin resistant. Initially, you become insulin resistant, then you become obese, and then you become diabetic. So this is the usual process. So mostly an obese, for mostly it has been seen that a diabetic people, type 2 diabetes, will be obese, or if somebody is obese, will have great chance of become diabetic in future. Is it clear? Make sense? Okay. Any more question? Okay, very interesting. Let's take this. Navnita, see this. Okay, so I can use virgin coconut oil. I like this type of question. I can use virgin coconut oil also on cooked rotis, Nasar. Yes, definitely. If you're not cooking. By the way, you are looking handsome, sir. As usual, as you heard for helping people. Thank you so much. Or any more question?
How do I manage blood sugar fluctuations during intensive long duration exercise?
Okay, so during intensive long duration exercise, it is very common to have fluctuations in your blood sugar. You don't need to manage unless and until you have any kind of symptom. Okay, unless and until it's troubling you, then you need not worry much. And if your blood sugar is below 200, nothing to worry. Okay, any more question?
One more question. What are the 3 R's rule for diabetic?
I don't know. What is that?
Means maybe for the intervals of diet or medication, three
Oh,
hours
okay.
rule.
3 hours rule. So I don't know. I don't follow this 3 hour rule. Maybe I don't know what exactly 3 hour rule mean. If maybe 3 hour rule means that every 3 hours you need to eat something. I guess this is my understanding, but I'm not sure about it. But I feel that most of the people, they recommend 2 to 3 hours that you need to eat something. Why? Because they are on medication. When you are on medication, if you don't eat every 2 to 3 hours, then there is a high chance that you will go into hypoglycemia. To avoid hypoglycemia, uh, most of the endocrinologists, they recommend eat more frequently within 3 hours. But this is not the concept which I follow. Okay, so this is not the concept which I follow. I have a different concept from the conventional theory. Many people ask, okay, one more question, very interesting question. People ask me, or many people get confused, when should we check the PP blood sugar? That is postprandial blood sugar. So everywhere, if you read the guidelines, every doctor, they will tell you that PP blood sugar should be measured from the first bite you take. Okay. And I say it in a different way. I say it that you measure 2 hours after last bite of the food you had taken. This is my own theory. This is my own opinion. This is not mentioned anywhere. And I don't follow any conventional. Okay, Navnita, I want to share with you one thing. Do you know how did I reverse my diabetes? I followed one video on YouTube, and that changed my life. The video title was, if you want to reverse your diabetes, if even you guys, if you know, if you understand Hindi, sorry, if you understand English, then type, you will get this video. It's a very old video, almost 10 years old video. If you want to reverse your diabetes, ignore the guidelines. You got my point? If you want to reverse your diabetes, ignore the guidelines. Please do a search, find that video, watch that video. It is in English. If you understand English, that video will change your life. So after that, I stopped following the guidelines. If you want to reverse your diabetes, ignore the guidelines. What the guidelines is, if you want to measure your PP blood sugar, you the uh, uh, food particularly you are taken inside your body, from that time, after 2 hours, you measure the pp blood sugar. This is not what I recommend, because this is written in guideline. I ignore the guideline. I say that you measure your blood sugar when you finish your food, from there after 2 hours. Reason behind is why they recommend from the start of the eating phase, because when you start eating immediately, there are a lot of enzymes which are released right from your mouth, and the digestion process starts from the mouth itself. And that's why they say you need to measure after 2 hours, because after 1.5 hour, 2 hours, there is a peak. There is a peak, and they want to see the peak. I don't want to see the peak. I want to see after 2 hours, usually after eating, and you can eat for 10 minutes, you can eat for say 45 minutes, you can spend 1.5 hour also eating in the eating phase, and the sugar level rises after 1 hour, 1.5 hour, it goes to the peak, and then usually it comes down. That's why I recommend that after you have finished eating, from there the sugar level start rising, or before that also, and at a certain point in time it will be very high, and then again it comes down. So what I'm interested to see is whether after 2 hours, whether the blood sugar is below 140 or not. If the blood sugar is after below 140, then I say it's absolutely normal. If it is between 140 to 200, then I say it is in pre-diabetic state. And if it is more than 200, then we consider this as a diabetes. So I don't follow the guidelines. I I have my own opinion, I have my own research, and I follow my own theory. And this is how I help people reverse their diabetes. And this is why the other people, the conventional doctors, they are not able to reverse anybody's diabetes. They are not able to stop the medication. Okay. Any more questions you have?
What are the pillars of diabetic management?
Okay. So, pillars of diabetic management, first is nutrition, second is exercise, third is stress management, and fourth is proper sleep. So, these are the four pillars. Okay. These are the four pillars. If one pillar is damaged, not working properly, weak, then even if all the three pillars are strong, you will not be able to manage diabetes. So let's take for an example, if somebody is following a proper diet, doing exercise, and having a good sleep, but at the same time, they are very stressful. They have stress throughout the day. Will they be able to reverse their diabetes? Maybe, may not be. Maybe, may not be. Okay, they don't have stress, eating proper diet, doing exercise, but not able to sleep. They cannot sleep at night. Will they be able to reverse the diabetes? Maybe, may not be. Very difficult. Sometimes they follow the nutrition, uh, no stress, sleeping properly, eating properly. Unfortunately, they are not doing any kind of exercise, especially strength training. Then also they cannot reverse their diabetes. So all the four pillars are equally important. And in Diaphit, we follow a holistic approach. We just don't focus on nutrition. We focus on nutrition. We focus on exercise. We focus on sleep. We focus on reducing stress. Everything. It has to be a holistic approach, and then only you will be able to reverse diabetes. Okay. Any more question?
How does pre-diabetes and vary from diabetes?
How does pre-diabetes
Differ from diabetes. What are the difference between both?
difference? Pre-diabetes is the initial stage before you become diabetic. If I talk about the HB1C range, So if your HbA1c is between 5.7 and 6.5, if it is between that, then you are in pre-diabetic range. If it is more than 6.5 or 6.5 or more than that, then you are in a diabetic range. So first you have insulin resistance, then you become obese, then you become pre-diabetic, and finally you become diabetic. Okay. Okay, so let me take this question. I think, mm, sir, I had been suffering type 2 diabetes from 21 years, but my fasting insulin and C peptide is very low. Is it now type 1? If you are suffering from diabetes for type 21 years, more than 2 decades, then yes, if the insulin level is very low, then definitely you are moving towards type 1 diabetes. Yes. सर किडनी पेशेंट को क्या डाइट देना चाहिए? प्रोटीन 25 ग्राम, कार्ब 25 ग्राम, फैट एंड दिस इज कंडीशन टू दिस बेटर. आपके हिसाब से, सॉरी, I'm not able to understand this question. I'm not able to understand. There are a lot of videos on kidney patient. Please watch my videos. Huh? So can I use coconut? Can I use virgin coconut oil also on cooked rotis? No, sir. By the way, you will look. Oh, okay. I think I answered this. Sir, yes, yes. Definitely coconut. Sorry, I think I missed the first thing. Coconut virgin oil. Yes, you can use. I think I read it as coco- uh, virgin oil. Sorry, virgin olive oil. Sorry, coconut oil. Yes. Sir, I have a varicose vein in the left leg. If I do strength training, it pains even though I use stockings. Is it okay? Or so please uh, avoid leg exercises. Do upper body exercises if it's paining. So take precaution. Okay. Any other question?
What are the pros and cons of diet and medication?
Pros and cons of medication. Okay. So I don't see any pros of medication. There is only cons and cons because you will have a lot of complications, and one disease will lead to another. You cannot reverse your diabetes, so your drug dosage or the drug combination or the different formulas will be increasing, and you will have a lot of complications. So that is the con, and I don't see any pros. As far as diet is concerned, the pro is that you will reverse your diabetes, you will not need medicine, you will lead a healthy life. The only con which I can tell you is that it is a lengthy process. It takes long time. You cannot reverse your diabetes in 1 or 2 days or 2 months or few months. It will take long time. Okay, so that's the only con which I can see. Rest everything is porous. Okay. Any more question?
Is it necessary for me to do blood tests because I have a dental appointment?
I'm getting a call. Just 1 second. Huh? I'm getting a call. Just 1 second. Okay, sorry. I'm really sorry. I was getting a call. Yeah, please tell me what was the question.
Is it necessary to do my blood test because I have to visit to dentist very soon? So is it important? There's a question. Why is it important to go for a blood test?
Why is it important to go for a blood test to visit the dentist?
Dentist, yes.
I don't know. I don't think it is important.
For a
Why it should?
diabetic patient.
For a diabetic patient, okay. For a diabetic patient, why is it important to go to a dentist? Okay, very nice question. um, it is important to see whether your blood sugar is controlled or not. Okay, if your blood sugar is controlled, then everything is fine. If it is uncontrolled, then maybe if you're going to some dentist and all, they might have to do some dental procedures. And if you're diabetic, then they will take the precautions before that. They will guide you what to do. And if the blood sugar is extremely high and if some dental procedure needs to be done, then that should be avoided. That should be avoided if your blood sugar is very high. Okay, that's why it is important. Okay, Navnita, I'll take one more question today. Before that, one more comment, because I have some extremely important work. Please be mindful that I am absolutely busy most of the time. I have a lot of research work to do. I am on research now. I'm researching on many things. I'm studying. I have a lot of exams. I'm still a student, and I'll always be a student. And I keep learning every single day. Despite that, I take out some time so that I can help you, guide you. Please take all the benefits of this. Please share all the videos. Please watch all my previous videos, because I have taken a lot of time and a lot of research work. After doing a lot of research work, I had made those videos, and it took me long time. So please watch all my videos. I i hope that you reverse your diabetes just by watching my videos. I recommend people that watch my videos and reverse your diabetes. And if you can't reverse your diabetes, don't waste your time. Join a program, join our coaching program, or any other coaching program where you feel comfortable, where you have the trust. If you want to join our coaching program, please call the below mentioned number. Navnita will be happy to guide you. Okay. And many people might be thinking what exam I'm taking. Okay, I have a lot of exams regarding I keep doing research. Okay, so every year I take some kind of exams. I'm a certified nutritionist. I'm a certified fitness nutrition specialist. I'm a certified sports nutritionist. I'm a certified personal trainer. I'm a certified diabetes coach. I'm a certified strength and conditioning specialist. So I have at least 8, 9 certifications with me till now, and this will continue. Till the time I am alive, I'll be continuing with my studies so that I can update you with the latest features, latest updates, latest guidance, latest nutrition, latest everything latest. Okay, I'm way ahead of everything. When I started my coaching program, it was before COVID started in 2019, and everything was online. That time there was no concept of online coaching. I started before COVID. Now many people have come and they are boasting that we have 10 years of experience. There was nobody before COVID. COVID is just been I guess 7 years now, 7 years, 6 7 years, and they're boasting that we are in the diabetes reversal industry for more than 10 years. It's all bogus. Please don't believe them, because I started my diabetes reversal journey in 2017, been a diabetes coach since 2018, almost 8 years now. And during those days there was nobody online, nobody teaching about diabetes reversal. So all those people are bogus. Please don't follow them. You will just waste your time, you'll waste your money. Okay, I'll be coming live once again at 9 p.m today on my Diaphit app. So you can download the Diaphit app. The link is there in the description. Please download that, and a very minimal fee, less than a pizza. Also the fees for a subscription of for 1 month. Please join that, connect me there. Okay, so just before I finish, let me take a couple of questions. Sir, as you have told that we should consume 30-gram dry fruits, then on those days we can't take any other fat food, sir, because calories are going high. Calorie is not important for me. if you're on a daily basis, calorie is important, but you can take more fat as well. 30 gram of dry fruit is just one part of the fat. If your daily requirement is 80-90 grams of fat, then you can take 30 grams of dry fruits as well as other fat sources as well. Okay, so just check your what is the total amount of fat which you need. Okay, so type 1 diabetic is normal when diaphit follow with insulin. Is it possible? Yes, good health you can maintain with diaphit diet. If your body is not producing enough insulin, then you might need insulin at that particular in time. If you have type 1 diabetes or LADA, you might need insulin. And if you follow diaphit diet, you can lead a healthy life. Okay. Arun is saying all the best for your exams. Thank you. I need your blessings and good wishes for my exams. I hope I'll clear it in one go. Navnita, one last question and then we will finish this session. Okay. Is there any
What
question
are the
or
target blood? Yes. What are the target blood sugar range before and after meal?
before and after meal? Okay. So I have said in many of my videos that please understand the concept of time in range. That should be your target. Okay. 70 to 180. 70 to 180 time in range. If you can maintain that, that is your target. Your target should be that your blood sugar is always above 70 and it should be below 180. That is the target. Okay, I think we have taken a lot of questions and we are coming live more frequently, almost on a daily basis. I have some very urgent work now. Okay, I have few calls as well. I have to come live at 9 p.m. So the whole day was extremely busy. I didn't get time for myself. And so there are a lot of things to do. Thank you, Navnita, for taking all the
Thank you,
questions.
doctor. Thank you.
And if you have any other queries, if you want to join our coaching program, or if you want to know about book an appointment with me, you're most welcome. Call the number. Navnita will guide you. With that, let's finish this session. We will be back again with Diabetes Darbar. Till then, bye. Take care. Jai Hind.